Welcome everyone to another episode of Health Made Simple Show. I'm your host, Dr. Bart, and today, kind of a special episode in the sense that we are shooting live from my actual clinic. And today, so if it sounds a little bit different, it is because we're shooting a little bit different episode or a little bit different equipment here today. And anyways, today we're going to do what's called a clinical insight. If you've been with us before, you've heard me do some clinical insights. If this is brand new to you, welcome, of course, to the Health Made Simple Show. And the clinical insights, what I'm going to share with you today, I have a couple cases that I'm going to share with you that I just feel as though would have amazing input from the average person, you, me, every one of us, to kind of hear me walk through these different situations and cases that I think will be a little bit relevant to all of our lives one way or another. So with that being said, let's dive in. And of course, you guys, keep doing your thing, keep sharing it out, keep spreading the love. Appreciate what you're doing. Somehow, some way, we're reaching more people. That is really the entire intention of the Health Made Simple podcast. And always just a reminder here, the intention and also the constant reminder about this show, the Health Made Simple show, is that our bodies are designed to be healthy, that you are healthy, I am healthy. Our Creator's made us in the eyes of perfection. And as long as we get out of the way, our bodies are self-healing, self-regulating machines. So with that being said, let's dive right in. So first case I want to share with you today is 56-year-old male. I changed some of these just so no one knows exactly who I'm talking about. But if this individual is listening, they'll know exactly who I'm talking about. And I think they do listen to the Health Made Simple podcast, but it's okay. All right, 56-year-old male. And he decides that at this point in his life, he's deciding to take on a big challenge. He's going to run a marathon. He's run half marathons in the past. It's been a little bit, but he's going to run a full marathon this fall. So he's in full out training right now. And I see him in clinic just the other day. And I noticed some things a little bit different. Frankly, what do I notice? I'm visually observing him, and I notice that he's gained weight. So we have an open conversation. He tells me, yeah, since I've been training for the marathon, and follow me here, he's gained 10 to 12 pounds, and he's doubling down on his cardio. He's running 15 miles at a time, and he's gaining weight. And I know the reason why. So I asked him, why do you think you're gaining weight even though you're doing all of these extra miles, all this extra cardio, burning up calories? And he said, maybe it's because I'm following a program where I eat more carbohydrates. And if you've been in cycling or in long distance running, you're probably familiar with some things they call GU. Basically what it is almost every hour they have you eat more food, eat more calories, so you keep this sugar high, so you continue to have calories so you can burn them off while you're running, so you can perform better. The reason I'm sharing this with you is for this reason. Listen, we're not all professional athletes. I have some professional athletes, and when they come in here, and the number one goal, the intention, is that they're able to get back on the field on Sunday afternoon so they can play in their sport, and they're paid to do so. Listen, that's one thing. But for you and I, most of the people listening to this, we're not paid to perform. And this is where we have to make sure our intention and the why behind of it all is really important and is really clear. So I'm all for setting new goals, set new standards when it comes to, I'm going to do a marathon this year. I'm going to get a little stronger. I'm going to gain some muscle. I'm going to be able to do this many push-ups. I love it all, but it's not at the compromise of our health. And this gets lost sometimes. So what happened in this gentleman's situation, he decides that he's going to run a marathon. So he looks and finds the gurus, if you want to call it, about how to run marathons. Running a marathon is not necessarily healthy for us. Could it be? It could be. In this scenario, not. How do I know it's not healthy for him? He's gaining 10 or 12 pounds. He's a lean guy to begin with. Now he's adding 10 pounds to carry on 26.2 miles. Doesn't make any sense. So the reason I'm sharing this clinical insight with you is to pay attention to why we're doing what we're doing. And most important, here's the takeaway I want you to take. What is your standard? What is the standard that you have for all the next decisions? And it's real simple. The question we should be asking, is this healthy for me? When it comes to birthdays, eating a cake, is this healthy for me? When it comes to our next physical fitness goal, to gain more weight, to put on some muscle, whatever it may be. Maybe you're going to say, I'm going to have a PR, personal record, when it comes to bench press or squatting. Is this healthy for me? We had an open and honest conversation, which I appreciate and love that I can have with so many of you. An honest conversation. It's not out of judgment, but hopefully you have someone in your life that can just hold you a little bit accountable. And I asked again, we kind of chuckled. I said, so do you think this is good for you? To gain 10 or 12 pounds and put more miles on your body. It's literally like me telling you to create a misalignment in your car and drive your car more often. We laugh. We're like, no, this doesn't make any sense. To that being said, so a lot of you out there are doing some endurance sports, probably for another podcast, but can you perform endurance athletic activities, running and cycling and whatnot, and still be in ketosis? The answer is yes. We just have to look for in different places, and we have to ask different questions. And that question is simple: is how do I do this healthy? All right, that's clinical insight number one. And really the takeaway there is asking the question regularly: is what I'm doing healthy for me and my body? All right, that being said, number two, very interesting one. As a chiropractor, this is the stuff I've been hearing for the past 30 years of my career, and I'm going to kind of squeeze two in here. 40-year-old female, never been adjusted before. Comes in day one, some some hesitations, a little bit nervous, all the above. She has neck pain, pain going into her trap, like her upper shoulder, some of it getting into her arm at times. So I get her adjusted, all goes great, fantastic. We reschedule for her follow-up appointment the following week. She comes in. First thing she says to me is, "Hey, Doc, I don't know if this has anything to do with what you did or if it's even possible. And you're gonna think I'm absolutely nuts." And what's interesting about this, I've heard that statement probably 1,000 times before, but stay with me here. And she says, "I don't know if it has anything to do with what you did. But after you adjusted my neck the other day, when I left here, I feel like the light came back in my life." And she just paused and said, "What do you think?" I said, "Yeah, happens all the time." So however you want to describe the light coming back in your life. And she was a little bit worked up. She had a little bit of tears in her eyes and saying, "I've never had this before. I can't remember the last time I've just been able to see the world." These are her words. See the world, feel free again, the light coming back in my life. Everything felt so dark and dim. And I want to explain to you why and how that happens, because it happens every day in chiropractic offices across the nation. I promise you this. And it's not because we treat depression or anxiety or any of those things. But the beauty in the moment is this: when we remove interference between the way that the brain and the body communicate, we take pressure off of the nervous system, your body works with freedom, and that's when it works at its best. That's when we get to expose something we call your innate intelligence. Listen, none of us are supposed to be walking around in a dark cloud. None of us are supposed to be walking around with this kind of darkness or this intention or this anger or fear or worry. None of that is normal. That happens when we get stuck in fight or flight. So as chiropractors, we see this all the time. It is almost a common practice for us. Reality is most people don't know how to articulate it or put the two together here. So I really appreciate that morning she reminded me again of the gift I get to do every day, which is to help give, love, and serve to people and open up perspectives and opportunities that I don't even know what's going to take place. That was not my intention. I promise you, that wasn't my intention that day to turn the light back on in her life, although it kind of is. I will also say this: as chiropractors, our job is not to treat anxiety or depression. It's not even really treating neck pain or back pain. And I know that sounds odd. Really, our job as chiropractors is to remove the interference between the mind and the body, the pressure that's put on the spinal cord. Once you have pressure on your spinal cord, those nerves control and coordinate everything in the human body. And the moment you get pressure off of those, things get to work the way that they were designed to do. And that's why we see so many people have so many different amazing experiences with chiropractic, because when you get pressure off the nervous system, the power that made the body, heals the body, gets to do its thing. So it's a beautiful thing. Another quick side note, because it happened just 2 days later, a gentleman that I've been seeing for years now, without any poking or prodding to say this, he comes in and said, "I don't know if I've ever told you this before, but every time I get adjusted, my eyes open more and I see better. Every time I get adjusted." He's like, is that real? Or am I just making that up? I said, "No, it's real." Because when we have pressure on the nervous system, especially if you have upper cervical, upper in the neck, you have tension, you have misalignments putting pressure on the nerves, especially the nerves in between C1, which is your top vertebrae in the brain, those cranial nerves, everything tightens down. Vision slows down, tightens down, things will get dark. You end up in fight or flight. We take pressure off the nerves and the light gets turned on. All right, my big takeaway. Why am I sharing all of these with you? Because there's so many people I know, you might be one of them, that are walking around with just stuff going on, folks. If you're not addressing your nervous system, that is the foundation. We get so distracted, I think, sometimes, and chasing all these things. And I'm probably guilty of distracting people when we talk about things like whether it's a cold plunge or sauna and just all these fun stuff they're adding to our health. The root, though, the root for our health is the way that your brain gets to communicate to your body. And that is your central nervous system. That system is what's driving every cell, tissue, and organ in the body. So if you haven't yet, or you haven't recently, go visit your chiropractor. If you're around here, awesome, love to serve you. If not, there's thousands of them all around the nation. There's incredible men and women out there that are helping turn the light on in everyone out there. So my takeaway is this: your body's designed to be perfect, frankly. We get in the way. So give yourself an opportunity. Go to a chiropractor, or if you know someone that's just dealing with challenges. I don't care if it's anxiety, depression. I don't care if it's indigestion, constipation, heartburn, all of these things. They are all derivatives of your central nervous system. If you get an opportunity to help unwind some of those, get pressure off the nervous system, and let your brain and your body communicate like it's supposed to, there's a very good chance that you can have a better outcome versus not doing it at all. So those are my 2 clinical insights. I appreciate everyone who's listening to this. Keep doing the thing, keep sharing it out. Hopefully this clinical insight has hit a space and a place in your heart or in your mind or your body that says, man, I probably should take a little bit better care of myself. If you did that, beautiful, message sent, message delivered in just the way that we wanted to. With that being said, keep doing the thing, keep sharing it out, keep spreading the love, and continue to take deliberate action for your mind, your body, overall wellness. Y'all be awesome.